Now we're going to cover the 12 cranial nerves. These are the nerves that send information between the brain and the rest of the body. Number one is the olfactory nerve, and that's cranial nerve number one. It has a sense of smell. It's a sensory nerve. Number two is the optic nerve, cranial nerve number two, and it's a sense of vision. It's a sensory nerve. Number three is ocular motor. It's cranial nerve number three. It includes eye movement, opening of the eyelids, constriction of the pupil, focusing on objects, and it's a motor nerve. Cranial nerve number four is cranial nerve number four, and it has inferior and lateral eye movement, and it's a motor nerve. Number five is the trigeminal nerve, obviously cranial nerve number five, and it has sensations to the face and mastication. So it's both sensory and motor. Cranial nerve number six is the abducens. Obviously, cranial nerve number six has lateral movement of the eye. It's a motor neuron. Cranial nerve number seven is the facial nerve, and it allows facial expression, taste, control of tears, nasal, and salivary glands. It's both sensory and motor. Cranial nerve number eight is the vestibulocochlear, and it's hearing and equilibrium. It's a sensory nerve. Cranial nerve number nine is the glossopharyngeal nerve, and it's swallowing, salivation, gag reflex, ear and tongue sensations. It's both sensory and motor. Cranial nerve number 10 is the vagus nerve. It deals with swallowing, speech, regulation of pulmonary and cardiovascular functions, also gastrointestinal functions. It controls heart rate. Cranial nerve number 11 is the accessory nerve. It activates the sternocleidomastoid, turning the head, and swallowing. It's a motor nerve. And cranial nerve number 12 is the hypoglossal nerve, and it deals with tongue movement, speech, and swallowing, and it's a motor nerve. The spinal meninges. They're specialized membranes that isolate the spinal cord from surroundings. The functions of the spinal meninges include protection of the spinal cord, carrying the blood supply, and continuous with the cranial meninges. Meningitis can be a viral or bacterial infection of the meninges. There are three meningeal layers. There's the dura mater, and that's an outer layer of the spinal cord or the brain, because they're the similar in both the spinal cord and the brain. The arachnoid mater, it's the middle meningeal layer, and the pia mater is the inner meningeal layer. The dura mater, the epidural space between the spinal dura mater and the walls of the vertebral canal. This contains loose connective and adipose tissue, and it's the site for anesthetic injection. Next, we have concussions. Concussion is a violent jarring or shaking that results in the disturbance in brain function. A concussion is an injury caused by a direct or blunt hit to the head. Signs include dilated eyes, bleeding anywhere on the face or head area, problems with talking, vomiting, large deformity on the head. Symptoms can include that an athlete feels extreme headaches, dizziness, nausea, possible memory loss. This is an example of a dilated pupil. It's a process by which the pupil is temporarily enlarged with special eye drops. They call it mydriatic. It allows the eye care specialist to better view the inside of the eye. Dilation. It's a process by which a pupil is temporarily enlarged with special eye drops. Mydriatic. It allows the eye care specialist to better view the inside of the eye. This is an example of a dilated pupil, and it can also happen during a concussion. It can be a symptom, a sign. The Glasgow-Coma scale is the international medical measurements for head injuries that place concussions in degrees. A CT or CAT scan machine is a machine that uses computed tomography to create a 3D image of organs, for example, the brain, and can check for bleeding or tumors and other things. This is an example of the CAT scan. Next, we have Pearl, Pupils Equal and Reactive to Light Lab, and it's to perform a tracking and light tests. Anterior grade amnesia is the inability to create new memories after a concussion. A crazy example would be the movie 40 First Dates with Drew Barrymore. Retrograde amnesia is a loss of memory before the head injury occurred. An example would be to forget birthdays, events, things of that nature. There are spinal nerves and plexuses. The four major plexuses of the ventral rami include the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. These include the ventral rami of the spinal nerves C1 through 5, and they innervate the neck, thoracic cavity, and diaphragmatic muscles. And the major nerve is the phrenic nerve, and it controls the diaphragm. And this is the cervical plexus. Next is the brachial plexus. Again, it includes the ventral rami of spinal nerves C5 to T1, and it innervates the pectoral girdle and the upper limbs. And the nerves that form the brachial plexus originate from the superior, middle, and inferior trunks, the large bundles of axons from several spinal nerves, the lateral, medial, and posterior cords, and the smaller branches that originate at the trunks. We continue on with the brachial plexus and the major nerves. The musculocutaneous nerve, that's the lateral cord. The median nerve, the lateral and medial cords. The ulnar nerve, the medial cord. The axillary nerve, the posterior cord. And the radial nerve, the posterior cord. And this shows you the nerves as illustrated. Be prepared to identify them. Now let's talk about Alzheimer's disease. It's an age-related, non-reversible disease. It includes memory loss and confusion. There's problem with decision-making. Eventually can't recognize family and friends. It's caused by a breakdown of the connections between the neurons in the brain and later ending in death. The most common ages of Alzheimer patients are 65 or older, and at the present time there's no cure for Alzheimer's. Some general fears that are connected, sort of behavioral biology or behavioral psychology related to the brain would be anthrophobia, fear of flowers, anabelophobia, fear of looking up, aviatophobia, fear of flying, cleanophobia, fear of going to bed, colorophobia, fear of clowns, dyspostrophobia, fear of throwing stuff out or hoarding, essophobia, fear of dawn or daylight, ornithophobia, fear of birds, and then obsessive compulsive disorder, fear of not performing a behavior that reduces anxiety. These would be some things that would be psychological that are related to the brain and the nervous system.